Hello friends, I am Dr. Rajat Malot, Director Malot Hospital, Jaipur. Today in this video, I am going to discuss that the CTEV tenotomy, does it require admission or does it require general anesthesia? Friends, first of all, I would like to highlight that the tenotomy is a very essential procedure in Clubfoot. If we don't perform tenotomy, there is a high chances of recurrence of CTEV, and the most important thing is that the child will not able to wear a particular splint because of the inadequate correction. I get a lot of phone calls from the parents that as soon as we started putting the DB splint in a CTEV child, if the tenotomy was not done, the child was immediately taking off the shoes, or he was crying a lot because of the inadequate positioning of the foot in the splint. So my experience is that the tenotomy is a very essential procedure in clubfoot treatment. We should not avoid it, or in case if we want to avoid it, we must ensure that the heel is adequately positioned. So in my experience, almost 90% of the children require tenotomy, and it is a very good and essential procedure to fully correct the CTEV. Now the important thing is that for a CTEV tenotomy procedure, does we really require an admission or a general anesthesia? Friends, with my experience, as I am doing this procedure for almost 15 years, my need for hospitalization or a general anesthesia is decreasing a lot. Now in almost 1 or 2 cases out of 20 or 30 cases, I require a general anesthesia or admission. Those cases which require anesthesia I'll discuss later in this video. But first of all, let me ensure that this procedure can now be done under local anesthesia. It doesn't require any kind of general anesthesia, and there are few advantages if we do this procedure in local anesthesia. First and very important thing is that we don't require a child to be 6 hours fasting. For parents, this is a matter of concern that if a child is fasting for 6 hours, it's a big period, and there it's very difficult to handle that child for parents. So the biggest advantage of doing it under local anesthesia is that we need not to keep the child fasting. Secondly, we can avoid the cannula pricking, because if we want to give general anesthesia, we need to admit the child and put a cannula in the arm or a forearm to give the drugs, and that can also be avoided. Third and very important thing is that we need not need to admit the patient for 24 hours. It is a big period. There are few parents who come from the nearby areas, and getting admitted for 24 hours can put a huge financial constraint on them. So that is the biggest advantage, that we can avoid admission of the child. How do we do it? So we actually put a 0.5 ml of local anesthesia, that is a xylocaine, after sensitivity testing, which is done in a usual manner, and then we put this 0.5 ml of xylocaine around the heel area and around the tenotomy site, and then we wait for 15 minutes to get its full effect. And then with a 15 number of blade, we just snip off the tendoachelis tendon to complete the tenotomy. And the most important thing, that with local anesthesia, we don't require any kind of suturing or any kind of wound management. It is the bleeding usually stops by itself in 2 to 3 minutes, and then we can start the final plaster. Friends, this is a very easy technique, and the only thing is that the experience of doctor matters. Sometimes, if a doctor has done less number of tenotomy, it is very difficult to palpate the tenotomy and do the procedure in a right way. So if the doctor is beginner or there is less experience, then only general anesthesia is recommended. But if the doctor is experienced, we can easily do it under local anesthesia. Now there are few children whom we prefer general anesthesia, and the first and foremost patients whom we prefer general anesthesia is a very chubby patient. There are few patients or few children who are very fatty, and it is very difficult to palpate the tendoachelis in those fatty persons. In those cases, we don't take a chance, and we actually give an anesthesia so that the muscle can be relaxed and it can be easily palpated. but the number of such children is pretty less, and almost in 1 cases out of 50 I require a general anesthesia for such children. Secondly, if the child is been referred by some other specialist, if they have plastered and it has not they have not done adequate plastering, in that cases we actually do it under anesthesia simply because we want to stretch some other tissues as well along with the tenotomy, and in that case general anesthesia help us. Third reason is a child who is pretty old, like around the age of 6 months to 1 year, where multiple treatment has been done in the past. So as the time progresses, after the tendo-Achilles tightness, the posterior capsule and other structures also gets tightened. So in that cases, it is mandatory to do a tenotomy and a posterior capsule stretching. So in those cases, I prefer a tenotomy under anesthesia so that I can stretch the posterior capsule also. So these are the few indication only where I prefer a general anesthesia, but that number is not very much, and almost like 2 or 3 months, only 1 or 2 cases I do under anesthesia. So the first and foremost thing what I want to highlight is that a tenotomy is a very essential procedure. It should not be avoided. And secondly, if your doctor is experienced, it is advisable to do this procedure under local anesthesia. With this, I want to conclude my talk, and if you are really want to consult me regarding your CTEV problem, you can either do a video consultation with me or you can visit my center. I'm a director at Malot Hospital, Jaipur. Thank you.